So hi everyone, welcome to this evening session. My name is Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS, and I'm very happy to be joined tonight by Physiotherapist Josh Poole, who is a Senior Physio in Colchester and also runs sessions for the NASS Colchester branch as well. Hi Josh, how are you?
I'm not too bad, thank you. It's good to be back, and I hope the members are also happy for me to be back too.
Absolutely, yeah, we've had lots of likes on the post advertising the session, so I think we'll have lots of people joining us live, and hopefully lots of people catching up afterwards as well. So we're really pleased because you've run a session for us before on HIIT exercise, so it's really great to have another one because that was really popular. Before we get started on the exercise and get into the session, do you want to tell us a little bit about both yourself, what you do, and also about HIIT exercise itself as well for people who haven't seen the previous session?
Yeah, sure. So, thank you, Zoe, for the introduction as well. I'm Josh. I'm a registered physiotherapist. I currently work in an NHS trust. My role is exceptionally busy at this current point in time, but thoroughly enjoy it nonetheless. And, you know, I've been a qualified physiotherapist now for about 6 years. However, I've worked with our NASS local branch for the best part of 7 or 8 years now. I started as an assistant, supporting poolside and with the gym classes. And then when I qualified, could not keep myself away and enjoyed it that much that I wanted to stay on. And now I help to also support the leading of the service in our area. The reason why I love NASS is that all the members that we've always had contact with have thoroughly enjoyed being more active and engaging in there. So for me as a physio, it's the dream job, to be honest. So I'm very fortunate, especially with the members I've had, and also the other branches that I've worked alongside over the past year and a half. With COVID and supporting virtual sessions. So this has been a fantastic way in us using technology to help improve activity and also support our members from afar in a safer environment. However, we're all have been itching to get back in the pool. Me personally, because it actually helps me with my own personal injuries. But, you know, it's a great way to support multiple conditions, to be honest, hydrotherapy. However, the reason I'm here today is to do another HIIT session with you all. HIIT stands for high intensity interval training. It's aimed at, you know, increasing your heart rate. So there's many other benefits of, you know, including fat burning, strengthening. But from Ankylosing Spondylitis or Axial Spondyloarthritis point of view, it's actually been proven to support muscle strengthening and joint range of movement. For our members, you know, sometimes exercise tolerance can be quite low. So doing more of a shorter, concise session can actually provide you with a multitude of other benefits, you know, for hours afterwards. So therefore, you can make it, you know, as you want it to be. It can be seated, it can be standing. We do it in the pool. You know, there's many ways you can do it. And that's why I love it, because it's so adaptable to the person. In terms of high intensity interval training, you know, we don't do it to a level that is necessarily recommended for the purposes of, you know, like I said, fat burning and that aspect, but the benefits are there nonetheless, you know, to get people up and moving. And that's the main aspect of what we try to achieve with NASS. So, you know, for me, it's proven a lot of benefits. Our NASS members have taken it up fairly regularly now. They don't seem sick of it at the moment. So this is why I like to share it across the board as a very quick and efficient way to keep your activity levels up, but also to give you other additional health benefits.
That's brilliant, thank you. And absolutely, thank you for all the work you and all our physios do for the branches as well, because I know our members really appreciate it and we really appreciate it as well. Yeah, we've got lots of people joining us live as well. Already got lots of comments coming in saying hi. We've got someone joining us from Norway. Hi to Stefan, joining us from Norway. And Anya said she's really happy to have you back as well. So yeah, lots of people joining us this evening. Before we go into sort of the live exercise session, I'll just explain a little bit in terms of safety disclaimer for everyone. If you want to join in live, obviously you're more than welcome to, but the video will stay on our page afterwards, and you'll also be able to catch up on our YouTube page and on our webpage, My AS My Life. So if you're not sure if this is suitable for you, you can always sit back, relax and watch Josh doing all the hard work, and then you can check with your physio or your doctor afterwards to make sure it's suitable for you. Similarly, I think you're going to do a couple of rounds of exercise, are you?
Yeah, so the main aim is 2 rounds of 5 minutes. I was thinking about 3, but considering time, this is a taster session anyway. So it's aimed to show you what you can do, and you can play around with it. I'm hoping that Zoe will share details if you ever wanted to get in touch in future through NASS. Then I'm more than happy to support. But yeah, so it's going to be 2 sessions of 5 minutes, and then there's going to be, I've added in a 5-minute example of what I call a stretching intensity interval training session. So something that's aimed at promoting range of movement as well after doing some exercises. So the aim is to warm your muscle tissues up, and then afterwards do some more dynamic stretching to hopefully give you some benefits. But echoing what Zoe has said, please only engage if you feel you're able to. I'm going to try and balance out between standing and sitting based exercises to try and promote movement in any way that's comfortable for our members that are here today.
Absolutely, that's perfect, thank you. So yeah, you can always watch the first round of exercise and then join in the second one if you feel it's something you're comfortable doing. Also, we do recommend, especially if you're standing, make sure that you've got a good amount of space around you, free from any potential trip hazards. Pop some comfortable trainers on as well, so you're nice and supported, and grab a drink of water as well, so you've got that handy for the break as well. And I think that is everything. If you have any questions, I'll be keeping an eye on them through the session. So do pop any questions in the comments. Hi to Joanna, who's watching as well. She said, great to see you, Josh. Oh, wow, Miranda from South Africa is watching as well. We've gone global tonight.
I've got no problem with travelling abroad, by the way. Expensive paid, I'll quite happily come across to any countries to do this.
And obviously you need me there as an introduction. So yeah,
absolutely, of course. Yeah.
Perfect. Well, is there anything else you wanted to mention before you get started, Josh, while everyone's grabbing trainers, drinks?
No, it's just about enjoying the session, really. Watch if you want in the first instance, and try the next session. The warm-up, to be honest, is actually really included in these sessions as well. You just take it to the level that is comfortable for you. This is no way to inflict any discomfort. It's about getting benefits from exercise and increasing your heart rate a little bit, make you breathe a little bit harder, just engaging in that activity, really. But at any point in time, if you need to stop, make sure you sit down, have a rest, and then maybe try the other exercise. It's entirely up to you.
Perfect. So I'll let you take it away from here then, Josh. I'll hide my camera and mute myself.
Thank you very much. So I can't see anyone now, which is great. So before we begin, like Zoe said, please make sure you've got some, the right clothing on that's comfortable to move around. Have a drink with you. You will need a chair for some of the exercises, or if you obviously want to complete the exercise in sitting. I have got some weights with me, but I'm only using tins. So I've got 2 tins of soup that I'm going to use as some form of resistance, because resistance is actually a good way of, building muscle strength as well. So that's the only things that you will particularly need. I will continue talking and go through the session. The exercises, so there's going to be 5 different exercises, all lasting for 30 seconds. And then there's a 30-second rest period. But during that 30-second rest period, I like it to be active. So whether you're doing some toe taps, you're moving your shoulders around, or just doing some gentle neck movements, keep that body moving throughout those 30 seconds, but at a lower intensity. So the higher intensity is for those 30 seconds of activity. The active rest is a very low level activity, but making sure we're keeping that, heart pumping with that blood flowing around the body. So the exercise that we're going to do, I'm going to push my chair back now so you can hopefully see me all. See all with me, even. But I'm going to put my chair to the side so you can see what I'm doing. Once I've adjusted my camera position. There we go. You see my tins of soup there. Fantastic. So the first exercise for people who engage in standing is going to be simply sit to stand. So that's where your bottom touches the chair and come back up again. Okay, and it's basically like a squat exercise. So we do that for 30 seconds. Whether you want to have weight either side of you, like so, please feel free to do so, just to make that exercise a little bit harder. For those in sitting, all I'd like you to do, if you have arms on your chair, you can push up so your bottom just comes up off the chair a little bit, so you're putting a little bit of weight through your legs, or you can do some marching, okay? The second exercise that we're going to do, just to check my list, is going to be marching on the spot and punching forwards, okay? But this has to be at a good rhythm. You're thinking good posture throughout, chest up and out, you're pumping those arms nice and hard, okay? For the seated aspect, very similar. You're in the chair, marching and punching at the same time if you feel comfortable. The thing I have difficulty with is my coordination. The next exercise that we're going to be doing is side steps and lateral and reaching out to the side. Okay, so you're stepping out, you're reaching, you're sort of bouncing across and reaching across your body, because this incorporates a bit of spinal rotation. You're thinking about balance on your legs, you're moving at quite a quick pace, so therefore you're getting those cardiovascular aspects too. In the chair, for example, you'll be reaching across either side. So you're reaching as far as comfortable, rotating your spine, but you're still putting weight through your legs, which is really, really important. The next one will be, hopefully with weights, again, if you're comfortable doing so, you're stepping forwards with weights in your hands and you're lifting your arms up. But what you do is you then alternate the leading leg, okay? If sitting in the chair, what I'd like you to do is engage that movement, so you're leaning, you're rocking your hips forwards, you're putting your weight through your lower limbs, and you're reaching up and looking up. And as you can see, you're really then stretching the upper part of your spine, okay? So leaning and reaching up. And then for the final, fifth exercise, we shall be doing high knees and rotations. Again, you can use weight if you want to, but it's about rotating your spine and lifting those knees up nice and high. And what you can see is you're actually moving the spine at the same, if I get my coordination right, left, like so, okay? Standing up nice and tall. In the chair, again, very simple. You're rotating left and right to what is comfortable. All right, so I'm going to set my phone to start in the next few seconds. And what we'll be doing is that sit to stand exercise first, okay? I am going to do the exercises in sit to stand or in standing. I hope you can follow sitting in the chair, just trying to practice some of those movements as well. All right, so we are going to start with the sit to stand exercise in 3, 2, 1, and off we go. So leaning forward, sitting up, standing tall, squeezing your bottom muscles, and back down again, okay? Try and get good level of movement going, pulsing up and down, working those lower limbs, sticking your chest out as you stand up nice and tall, stretching it up and back as well. Good. We've only got 5 seconds left. 3, 2, 1, and rest there. And when I say about that active rest, so during these 30 seconds, you're moving those legs, whether you're doing some toe taps, doing some nice deep breathing exercises, all of that is going to be a benefit and it's going to keep you moving throughout this whole session, okay? Right. So the next exercise starts in the next 5 seconds. 4, 3, 2, 1, and it's marching and punching, okay? So you can see what I'm doing side on. Notice I'm trying to keep my hands at the same distance apart. What you can do is you can rotate left and right as well if you want to. But having some weight, again, it's really important to have that resistance, which helps with muscle strengthening. Plus it makes it just that little bit harder. Right, 10 seconds to go. 5, 4, 3, 2, 1. Good, and rest there. Again, you're keeping yourself moving, stepping forwards, back, doing maybe a gentle march, toe taps, anything that keeps that blood flow going around your body. Okay, so in 15 seconds, we'll start the next exercise. Again, I'm going to show you in standing, where you're going to step and reach out to the other side. For those who are a little bit more energetic, you can add a bit more rhythm to it. If not, you can just stand there and just reach left and right. Or again, you can do that in sitting. So off we go. Reaching right, left. Get those feet moving. Good. "15 seconds to go." All the movements I'm trying to do incorporate getting your heart rate up, but also adding some form of rotation, movement, something to keep the spine moving. And rest there. Again, keeping that active rest going. Oh, getting tired myself already. The next one, which will start in the next 15 seconds, is stepping forward, so like a little lunge, reaching all the way up. I apologise about my camera angle. Reaching up, like so. So you can see it from side on, you're stepping forwards and reaching up. okay? And again, you can do it in sitting. So off we go. Step forwards and reach up. Step forwards, reach up. Incorporating your whole body with this movement works every aspect of your spine. In fact, it works every aspect of your body. You're using your big toe to stabilize yourself up to your neck, looking all the way up and stretching everything, okay? 5 seconds to go on this one. 3, 2, 1, and rest there. Good stuff. Hope everyone's enjoying this so far. Keeping myself moving all the time. The final exercise that we're going to do for this set, which is the 5th one, is high knees and rotation. So again, for those who are more energetic, you can be going quite quickly. For those who just want to focus on maybe a bit more range of movement, you can go up and hold and rotate. For those who feel more comfortable doing it in a chair, again, same principle, just whatever's comfortable, okay? You're trying to work everything in sync, all right? So off we go, all right? So alternate elbow to alternate knee, okay? Trying to get a good rhythm, working on that coordination, which I also struggle with. 10 seconds to go. 3, 2, 1, and rest. So that is the first round done. Now my heart rate is up to 113 beats per minute. So it's already starting to hit that cardiovascular work rate sort of level. So that's really quite good. And hopefully you're a little bit out of breath, maybe a bit warm, you know, and you feel your heart pumping a little bit. It's all good signs of good levels of activity. So we are going to go straight into the next session, which is sit to stand again. All right. So in 3, 2, 1, sitting down and standing back up again. I've got my weight to either side. I'm trying to be quite strong, quite quick with those movements, okay? But controlled. 15 seconds already done. 15 seconds left. Five to go. 3, 2, 1, and rest. Well done. Again, keep moving. You can have the weights in your hands if you want. You can put them down. You can have a quick drink within 30 seconds. Please do. It's important to keep yourself hydrated, as that is also very good for your joints. So the next one is punching forwards, marching on the spot. If you feel a bit more energetic, you could be running and punching, brilliant. If not, just punch, march, or do it while sitting in the chair, okay? So I'm thinking about trying to hit multiple joints at one time, working a lot of your muscle tissues, okay? And off we go. Okay, so punching forwards, either marching or jogging on the spot. Okay, I'm changing my position just so you can see how I'm completing it. I'm trying not to keep them any higher, any lower, nice and neutral. Okay, so you're working on that shoulder stability as well at the same time. All right, 5 seconds to go. Good, and rest there. So the next exercise, okay, is again, it's that sideways movement, reaching and coming back. Okay. Like so. We're going to start that in the next 15 seconds, okay? So again, shoulder rolls, keep everything moving, maybe have a nice big stretch, open up your chest, take a few nice big deep breaths, okay? And off we go. So step, reach. Again, you can do this in sitting by rotating left and right. So we've already done 15 seconds of this one. 10 to go. Into those final 5 seconds. 2, 1, and rest there. Good stuff, everyone. Keep it going. 30 seconds rest. The next exercise, stepping forwards, reaching up. Stepping forwards, reaching up. Again, so you can see me coming forwards. Leading with alternate legs. So you're doing basically like a mini lunge. Okay? Again, if you're sat in the chair, you can sit down and be practicing reaching and stretching your spine up. Okay, so 3, 2, 1, off we go. Up and stretch, using your whole body to complete the movement. The whole body works together. 20 seconds to go. Keep up the momentum. It's up to you how much you'd like to get out of this exercise, so how much you engage, okay? Activity is singly the most important thing to prevent multiple health conditions. And rest there, okay? Steps on the spot, keep moving. Only one more exercise to go, and that's that very quick HIIT taster session done. So I'm keeping myself moving 10 seconds, and the next exercise again is elbows to knees, okay? Again, can easily be done in sitting. Right, 3, 2, 1, off we go. Try and put it in for this last one, okay? Only 30 seconds to go. $15 on the clock, and we're nearly done. This is great stuff, everyone. Keep going. 5 seconds. 2, 1, and rest there. Right. So that's the first session done. I'm going to give you a couple of minutes as I talk through the next one. Please grab yourselves a drink. Work on your deep breaths. Now, unfortunately, with AS, and as most people know, that can affect your spine, but it can also affect your rib movement. So breathing control is a really important exercise to help improve your lung volume and capacity, and also prevent your risk of future chest infections. Okay, so breathing control is really important. So every hour, you should be really taking 3 or 4 nice big deep breaths in through your nose. That helps to humidify the air, holding it for a second or 2 and blowing out. So during those active rest seconds as well, it's a good way to start working on that control, because then you start to control your breathing rate and also your heart rate, so therefore enabling you to carry on doing more exercise, okay? So as a day-to-day task, especially as we're approaching these winter months, regular deep breathing exercises are really, really important to prevent yourself from developing chest infections, or to manage if you do develop a chest infection, okay? So keeping your lungs nice and clear, but also during exercise, when you need to take in that oxygen, during those active rest moments, during HIIT sessions like this, it's really important to slow, control that breathing, get that oxygen to flourish your muscles so they get stronger and then you don't fatigue too quickly. All right. So the next session is just a taster on doing a dynamic stretching based session. And what I'm trying to do is incorporate all ranges of movement, okay, from your lumbar spine, obviously up to your C-spine, but using your upper limb and lower limb to help support those movements. Muscles are like plastic, and if you do not warm them up, therefore, or make them more malleable, you're at risk of injury. So it's really important to keep stretching at a fairly dynamic movement, okay? Just doing static stretching when you're quite cold and you haven't engaged in a little bit of activity can actually increase your risk of injury. So it's really important you warm those muscle tissues up, all right? So what we're going to do is we're going to do 30 seconds on and 30 seconds off again of stretching, okay? And I'm going to go through 5 different dynamic stretches that we can all do. It's going to hit the lumbar region, it's going to hit some rotation, it's going to hit some extension, okay, some side bends, you know, and it's then going to work on the neck, okay? So as we begin, you can do these in seating, but I will demonstrate in standing as well, okay? So the first one will be lumbar flexion, okay? And what we want to do is when you have your hands in front, then shoulders up and back, chest out, and I want you to gently go down to a point that is comfortable, coming back up again and opening your chest out, okay? So you bring your hands back down again. So you do it in a very slow, controlled, fluid movement, okay? And we'll do this for about 30 to 45 seconds. So that's the activity number 1. And then in those 15 seconds, we can keep ourselves moving, we're slowing the heart rate down, we're cooling ourselves down as we do the stretches. The next one is rotating left and right. It's again similar to what we did in the HIIT session, but you're reaching. So we're using a bit of Tai Chi, okay? Reaching, pulling our hand across. Imagine we're pulling on a rope across our body, and then you're doing the same the other side, okay? So it's about the slowness and the control of the movement. Thinking about what your spine is doing as you do these movements. And it's also good for the core, okay? So that's the second one we'll do for 30 to 45 seconds, okay? The next one is side bends. So you can either do it static or sitting, for example, okay? When you bend, tilt slightly to the side, come back up again, that's comfortable, and then to the other side. I always promote that coming back to this neutral position before you commence the next one is really important, okay? So you know you feel comfortable and then you're ready to prepare for the next movement. A bit more advanced, what you can do to stretch these muscle tissue here, the latissimus dorsi here, you can run your hand down your side and then reach over, and then again doing it in this nice sort of fluid motion, left and right, okay? So that's exercise / stretching number 3. Number 4 is what I call thoracic extension, okay, or what most people would call in the profession. But you can either do this sitting down with maybe a table in front of you, or if you have a chair, you step back, and what I would like you to do is to gently sink yourself forwards, stretching that spine out. It's actually extending quite a large portion of the spine, but it's really good for that upper back. But then when you come forward, you're leaning and you're reaching and looking up, okay? So stretching down and then stretching up. Okay, so that's the next one, again for another 30 to 45 seconds. We are then on the 5th and final one, which is just going to be working neck range of movement, okay? Thinking shoulders up and back, thinking about your neck posture. Again, if you're, a lot of people unfortunately who suffer with AS might have quite a forward neck posture. So it's about trying to think about working these muscles at the back here, those extensors. So I want to think shoulders up and back, head in a nice neutral, comfortable position, and then you're looking over to your right. You're looking forwards, and then you're tucking your chin in like so. You're then going back to that position and looking over your left side. So left, middle, tuck, right. Nice and gentle and controlled, okay? And that's it. So we're going to commence that in the next few seconds. Okay, I'll probably whiz through this quite quickly. Instead of, because I'm conscious about time, I'm going to about 30 seconds continuous of each of these exercises. So we do it in 2.5 minutes. So if anyone wants to have any questions or afterwards, we've got plenty of time to do that. All right. So we're going to start in the next 5 seconds with the first exercise being lumbar flexion. So off we go. So you're bending down nice and slowly, coming up, opening your chest out, and then coming back down again, okay? Good. And what you should notice with the slowness of these movements is that you're relaxing yourself, you're taking some nice deep breaths every so often, you're feeling your heart rate settle, and your muscles certainly will find this much more comfortable. Good. Now we'll move on to the next one, and that is going to be either, I think it was rotation, wasn't it? So you're pulling your hand across, pulling towards you. So we'll start straight away. Okay. So you're pushing and pulling away. Nice and controlled. Deep breathing every so often. Good stuff. Brilliant. Okay. Moving on to the third one, which is the side bend. So again, either you can bend down to the side, reach over, and back to the other side. So I'll continue like that, or you can do some gentle side bends. Okay, coming back to that neutral position, and over to the other side. Okay, so I'm going to continue like so. I need to give myself a good stretch. I'll do that again for another 10 seconds. Good, and rest there. So again, have a chair in front of you or a table, something that is comfortable. This is a really nice stretch to do as well. If you've been maybe in the office or even walking around, they just feel a bit more comfortable. You get home, you know, you've got a nice high surface that you can lean on, you pop your hands on, step your feet slightly back, and slowly sink down, hold that stretch for a minute, and back up again, okay? But this part, the extension, is quite important, okay? Good, and one more. And rest there. And now last but not least, is working the neck. I'll do this in sitting. You can do it in standing, but it's very simply going to be thinking shoulders up and back, looking over to the right, back to neutral, tucking your chin in, relaxing, then looking over to the left. Okay, and what you should notice after a few repetitions is an increase in your range of movement, okay, because the muscle tissues are warming up. And they feel more comfortable stretching. So we'll just do one more, bringing back to neutral, chin tuck, and over to the left. Good, and I think I'll finish there because I wasn't sure how much time I had left, Zoe, so I do apologise. I might have had more to put everyone through some more punishment, I don't know.
No, that was brilliant, thank you.
I fairly rushed at the end, so I'd just like to apologise to all members. With the stretch, what I'll do is I'll share it with Zoe, and if she's happy to share it or people would like to see what I would have liked to have done, you know, then you can see it and maybe practice it at home or things like that, if that's all right. If I create a resource, if that's okay. That
would be fantastic. Yeah, we'd love to share that with everyone. Probably people joining in, if they've not tried HIIT before, they might have been glad that it wasn't too long.
Yeah.
A good taster session. We've not had any questions in at the moment. I think that's normally a good sign that people are watching and joining in. So if you do have any questions for Josh about HIIT or about the local branch or anything, if you're in the Colchester area, then do pop your question in the comments. No, that was really fantastic. A great kind of overview and really good to see people getting involved. Wendy said it was still clear, Josh, you did well with the time. So that's really great to hear.
Thank you very much,
Wendy. Thanks for joining in, Wendy. And I've put some links in the video description as well. So we've got a link to the NASS Colchester YouTube page because you've put loads of exercise videos there, Josh, so and your colleagues as well. So it'd be really great if people want more of these sorts of sessions. There are loads there that you can choose from. And we've got a comment from Gillian as well saying, thank you so much. I really enjoyed, as I could do most of them. Come back soon. So yeah, and I think Gillian particularly enjoyed being able to do them seated as well.
Brilliant. Thank you very much, Gillian.
That's lovely to hear. Yeah, and Wendy loved the dynamic elements as well. So no questions at the moment, but lots of praise and thank yous.
Oh, good. I appreciate that. I'd also like to take this opportunity to thank all of my colleagues, especially in our branch and across the country. I mean, like say, it's been a very difficult year and a half. So trying to get everyone back into that sense, you know, it has been quite difficult. But like I say, my colleagues, with all the videos they've done, the expertise, you know, they are far more advanced in their knowledge around MSK than I am. And they've put some really good stuff on our YouTube page and have always been great to support me in my development as well. So I just want to say thank you to them as well for that.
Oh, that's lovely to hear. Yeah, it's such a fantastic bank of resources there. So hopefully everyone will go check those out after this. Yeah, loads of lovely comments coming in. Paul Sarah says, great session. Anya says, thank you, Josh and Zoe. That was really good. Do like and need the stretching. And a nice balance for a range of people, having the standing and seated as well. So that's brilliant. Sounds like you hit the mark tonight.
hit the spot. Yeah.
Yeah. Oh, well done. Brilliant. Yeah, and Gillian says lots of it was like how she was taught on the Bath AS course. So that is high praise indeed.
Oh wow, I haven't been fortunate. I know there's sometimes funding for us physios to go, but obviously the way the past 18 months has been, we haven't been able to. But yeah, I've heard great things that course. I was fortunate to do an A stretch course a couple of years ago, and that opened my mind. I always like to make my exercises and movements functional, so it has more of an overlay to day-to-day life. So it's not always necessarily about specific isolated exercises. but about, you know, global movements, because at the end of the day, the body is designed to move in sync in certain ways. So encouraging as many muscle movements and range movement, you know, you're hitting a lot of areas at one point. So, you know, it's yeah, this is why I love doing what I do.
That's brilliant. And I think that's, people have really enjoyed those stretches towards the end there as well, because as you say, it is that kind of dynamic, moving your body like you do in life as well.
Yeah, they're very rushed. So I do, again, it's a taster session. So if anyone wants to go, you know, if any branches would like us to support them and we can do a session, I can certainly take a bit more time. Then there was supposed to be a bit of active rest between those stretches, but to be honest, like I say, I think it did work quite well, doing it quite fluid. But it was, again, just to give you examples of things that we've tried to do and we encourage our members to do on a regular basis as well.
That's perfect. We have got a question in from Peter asking, can you suggest any other neck exercises?
Yes, so there were only, like, I was hitting about 3 areas of movement, I think, for the neck with what I was doing. The neck is designed to flex, extend, rotate, side bend, and also combine those movements as well. But I know that with a lot of our branch members, and I hope they don't mind saying, they do struggle with their neck as well at times, and it can be quite uncomfortable. For me, just doing those gentle range of movement exercises, even lying in your bed, is brilliant, because gravity can actually aid those movements. So for a lot of our patients, for example, who have a bit of a forward head posture and it's quite uncomfortable, lying on a bed, there's some supportive pillows, of course, actually pushing into the bed and doing that retraction-based exercise is really, really good. So taking gravity out of the equation can help. Sitting up, it can be quite uncomfortable, but try doing them lying down. Have some heat on the area, loosen up those muscle tissues, and then practice those movements. And I promise you, it will certainly help.
That's really great advice. As you say, the neck can be really sore when you start exercising it when you're upright. So that's a great way of getting the movement going to begin with. That's brilliant. No more questions at the moment. Just lots of praise. So please do go back after the session, Josh, and read all the comments, because they're lovely.
Thank you. I don't actually have Facebook, so I might have to share them. Or I'll some way try and get onto there.
I'll send you some screenshots. We've got a question from Wendy saying, any exercises, I think, to support or strengthen the muscles around the lumbar spine?
So I like to do a lot of resistance training and also incorporate that, not just in my patients with AS, but I tend to work with, and this is not on our AS patients, so before I dig myself a hole, I tend to work with more frail patients in the hospital. So I work in our older people's services. And it's actually proven that adding weight to or resistance to these exercises, so in standing, for example, is actually proven to reverse the aging effects in muscle tissue. So I'm not asking all of my members to start doing things like deadlifts or big, heavy farmers carries, but, you know, carrying shopping bags, for example, is really good exercise for the spine as a whole, for example, whilst walking. But it's controlled because you can do that in the safety of your home. You'd have to have possibly a personal trainer, or like I would suggest your physio to go to show you what the correct form is that's right for yourself. But doing things like weighted deadlifts to a very small range of movement can be really beneficial. There's loads of other exercises you can do in the bed, like bridging, so lifting your bottom up. So strengthening your hip muscles, again, is another way of actually supporting your lumbar spine. Okay, so I was always taught by my lecturers at university to, if that area can be a bit sore or uncomfortable, work an above, below in those areas. So for example, do some exercise with the upper back, do some exercise with your leg, because conversely, that will actually support the area that's uncomfortable. So my advice is, if you can add weight and resistance, try and do that in a comfortable setting. If you're unsure about doing that, please seek a local personal instructor, physio, obviously. Sorry, it's my profession. I should be selling my profession. But someone who's in tune with it and can give you the correct advice seeing you. Other things in the bed, like I say, bridging exercises, pelvic tilts, knee rolls, left and right, are really good to promote that movement. Or, like I say, working your legs, walking is really good, or working the upper body, because that will support those bits in between, because they have to strengthen and stabilize yourself as you do those movements anyway. So I hope that helps and answers your question.
That's brilliant, thank you. Yeah, do let us know if that doesn't answer the question, but I imagine it will, because that was really, really helpful. Yep, which says thanks, that was really helpful. That is, yeah, that's all the questions that we've had so far this evening. So if anyone has any burning questions, please pop them in there. Now's your chance to pick Josh's brains. while we're waiting for any last questions there, I'll just share with everyone what the next session is going to be. So next Wednesday at 1 p.m, I'll be joined by rheumatologist Dr. Helena Marvo Ortega, and we'll be talking all about how axial SpA can affect men and women differently. So for that session, we're going to focus a little bit more on how axial SpA affects women. And then later on, soon we should have an expert talking about the other side and how it can affect men. Let's just have a look at the questions. No more questions? We'll let you off the hook lightly there, Josh.
Hopefully everyone's a bit out of puff and they can't.
Yeah, everyone's getting their breath back. Well, for everyone watching and anybody watching on catch up as well, please feel free to pop any questions in there, and I can always pass them on to Josh if you don't mind.
That's of course.
Wendy's asked Impact Sports view on this.
Again, I'd have to know a bit more about you, Wendy, to be able to say that's the case. It's about a graded approach. If it's something you're not familiar to or used to, you have to build yourself into it and obviously train the body in that respect as well. I'm a firm believer there's a balance between, quality of life and also, ensuring that you can maintain that quality of life. So it depends in a sense where you are in your journey, I suppose, with axial SpA to a degree. But again, this is something I would certainly point you in the direction of your local physical personal trainer, physio, osteopath, it's someone who can support you in terms of what is best for yourself. So I do apologise, I can't formally answer that question, but if there's a way you can do it in terms of a low impact graded approach to it, why not? It's activity. There's always risk, no matter what we do in life. You could step out your front door, you could trip over something, we have to embrace risk to a point, but we also have to understand that risk is there. And the more we understand and we understand what our limitations are, I suppose, or what our abilities are, the better that risk is managed. But as you say, you never know necessarily. So it's very difficult to always control those factors, but you should embrace risk.
That's really good to hear. She has said specifically netball. I don't know if that changes your answer or if you're still encouraging.
Well, classify netball. I have seen some netball matches and I've been surprised by the physical nature that it can get to.
I can vouch for that.
If played appropriately, there shouldn't necessarily be any direct contact. Forgive me if I'm wrong. So yes, it's very difficult to answer. From a professional basis of what I answer the sport, yes, it should be fine. But from what I've generally seen, that sometimes it can get very physical. So it depends on what your social mentality is like on the pitch. But please engage. Training for netball is brilliant. Even something like boxing training is really good. There's so many benefits to cardiovascular exercise and strengthening. So, but without necessarily obviously engaging in fighting.
She said in terms of kind of the floor impact, if that's hard on the body as well.
Well, you said about this next session and talking about obviously women's health in association with axial SpA. And, I say this very clearly, but, us male individuals are very lucky in comparison to our wonderful female colleagues and so on. And obviously at certain points in time when, this is very awkward for me to talk about, so I do apologise, but when certain changes occur at certain ages, your risk of osteoporosis and factors like that unfortunately do take hold. Actually, weight bearing and loading the bones is really good to help strengthen them and prevent osteoporosis and other factors with your bones from taking effect. So, I would say certainly so. You will know what your limitations are, and that's the only thing. Everyone is different. But actually bone loading and getting that what we call ground reaction force from running around or walking is really, really healthy. It's what we're designed to do. I hope I tried to explain that in a very sensitive way.
Yeah, no, that was perfect. We've had a couple of sessions on osteoporosis and one specifically on exercise. So Wendy, I'll reply to your comment later and pop the link into that session as well. Because my colleague Andrew, who's an osteopath, did one about exercising for bone health. So that will be good alongside that advice.
Oh, brilliant. I hope that was congruent with what has been said as well. I haven't seen anything controversial, but like I say, even that's why the pool is good, because you can then, if you've been having difficulty during land-based exercises, hydrotherapy is a really good way to introduce that. But hydro is only a part of your AS journey. It's a massively beneficial adjunct to support pain and symptom management, things like that. But inevitably, we are designed to walk around outside of water and things like that. So loading the bones, having gravity help us is really good for strengthening.
Absolutely. Yeah, that definitely mirrors everything that was said in that session. Don't worry.
Cool. Good.
That's brilliant. So I think I'll round things up there. It's been really great to have you answering everyone's questions as well. So thank you, Josh. That's really helpful. And definitely, if we can get you back, that would be fantastic, because there's definitely lots of demand for that.
More than happy to, anytime.
Wonderful, thank you. So if anyone's joined us partway through, the video will stay on our page, so you can catch up afterwards. We'll also pop it on our YouTube page and our webpage, My AS My Life, as well. And I'm very cheekily going to ask everyone, there is a link in the video description to a very quick survey. So if you wouldn't mind just taking a couple of minutes to fill out our survey and tell us what you think about our Facebook Live sessions, it will just help us with our planning for next year and get some good feedback as well to see how we're doing and any particular topics you'd like to see from us as well. So thanks again, Josh. That's been really fantastic, and loads of really great comments as well.
Lovely, thank you so much. I really appreciate it, and like I say, I love doing what I do. So yeah, please pass on details. I'm more than happy to support in any way I can.
Thanks so much. And yeah, I'll again just say we've got that link to the Colchester branch YouTube page as well, so please take a look there, all those resources as well.
Brilliant, thanks again for that.
Great, thanks Josh, and thanks everyone for joining us, and I'll see you next week.
Cheers, see you soon. Thank you, everyone.
Thanks. Perfect, I'll stop the live stream there. Brilliant. So many really good comments coming in. I can send you the screenshots if you like, if that's easier.
Thank you.
We've already had a couple of 100 views already. That's amazing.
Oh, brilliant.
Yeah, it's really good. And I think pitched at just the right level as well. A good intro, as well as, you know, showing the advanced exercise as well. That's brilliant.
I hope so, because sometimes I don't know what it is with me. Sometimes I do get my words muddled up. It's always something I've struggled with through school. So sometimes I thought I can remember something clicked in my head before the stretching session that I had in my diary till 1840, and I wasn't sure if it was going to stop automatically. So I was thinking, ugh. So that's why I can't rush. No, you're fine. That's not you. That was me. That's what I rushed through the final bit. So, I've got text from my group. That was great, Josh.
Oh, brilliant.
And my colleague Anya sent the link round for everyone to see. Brilliant.
Oh, that's the Anya that commented. Brilliant.
Yeah, Anya is like she's one of our members, but she also helps manage the finances. She's really good at organising us at times and manages payments and things. She's brilliant, like an absolute asset to our branch. But I think, to be fair, most branches have someone like that.
Yeah,
the sense of community is unbelievable.
Absolutely, you get that kind of core sort of few people who really keep it going, don't you, as well?
Absolutely.
I recognise her name from quite a few of our lives. I think she watches a lot of them. Yeah,
she's really active. She does a lot. And an interesting thing, and I'd love for them to do a study, actually, a qualitative study, would be looking, because she does a lot of cold water swimming. And she finds it really helps with inflammation. Obviously, you know, cold will help with inflammation. That sounds obvious, but you would also think, could that affect their joints and make patients worse because it's more of a rheumatological issue rather than, say, osteoarthritic? Well, you do get a combination of both at times, but you know, it's really interesting. She is a very active woman, so it helps having her there, because people can see that, you know, it's not always, you know, people's assumptions of what AS was, say, 10 years ago have massively changed. So I'm hoping some more younger members involved, because they do come for about 2 or 3 sessions, and I think subconsciously it's not that they don't want to be there. I think they see or fear what might happen later on, but it's not the case. So
yeah, especially with biologics nowadays, it's a very different trajectory, isn't it? There is I'll have to find the link. I think it was on the Wim Hof website. There was a very small study with people with AS, looking at inflammatory markers, obviously not applicable for everyone, but that and cold water exposure. So I'll try and find that, and I'll send you the link if I can find it.
That would be,
because I don't know how. I didn't look at the methods, whether it was particularly reliable, but yeah, I'll have a look. It was interesting, because I tried doing that, like the cold showers and things, but I started trying to do it in the winter, and so I just did not stick with it at all. I need to start in the summer.
Doesn't love like a burning hot shower. It's really cold. Do you know what I mean? It's
makes everything right.
Absolutely.
I'll make a note, and I'll have a look at that tomorrow. Cool. Well, thanks again. That was really good. I'm aware I should let you get on with your evening now.
I've got a deadline on Friday, so I'm going to write. I've got well, it's not the 6,000 words, it's only 800 words, but I need to get a formative submission in. So yeah, this is what my evening's going to be. It's going to be one tidying up. Oh, wait, let's show you the mess again. Yeah. So yeah, no, thanks again for bringing me in. I hope it was all right, and I hope my language was okay. And yeah.
Yeah, no, it was really good. It was, yeah, all good language for patients as well. So I know it's easy to slip into kind of technical terms, but no, it was all really good. And from the comments as well, everyone said really good level, really good understanding and everything.
Brilliant. Thank you so much, Jim. It's nice to see you. Hopefully we can catch up at some other point in time. I don't know. Hopefully things open up more and we can go to conferences or something like that. It'd be really nice.
Yeah, fingers crossed. It'd be really nice to have some face-to-face stuff going on again. Yeah.
If there is any East of England regional things going on, please let us know. I mean, we're happy for a few of us to come up. You know, we quite happily do that. So.
Oh, that'd be brilliant. Yeah. Oh, fantastic. I'll pass that on to Jill as well, because she's just doing one in Chester, I think. But yeah, I'll get us get out to the east a bit. I don't think they've been out here for a while.
No, it'd be good. Get some members, yeah, they'll enjoy it. And I'll quite happily even just do a live session there and then, you know. So
brilliant. Yeah. Oh, before I forget, Sally asked me to ask you, I think she's been in contact with the branch about, they wanted to do a post on social media about being back to sessions. She's not heard back from them, I think. If you don't mind giving them
me, if you can pass on, I will pass on my sincere apologies. So the trust has been under a lot of pressure at the moment, and my role is, so I'm doing a lot of work on patient flow. I'm working with NHS East of England on trying to reduce length of stay and things. So it's really, I'm at work quite a lot at the moment trying to combat our constant flow of patients. So I had to have a week off the other week because I think I burnt myself out a bit. I'm a yes man. I tend to say yes to it, and I like to do a lot of things, and sounds a bit cheesy, but help a lot of ways. So I just apologise. Things have got on top of me, and it's not that NASS has ever been the last thing on my mind, because we've still continued the sessions. I've still been doing them regularly, but trying to do additional stuff at home on top of family life and everything else going on. So I know I went to Paris last weekend, but that's been pre-booked for ages, and I needed that. So.
No, you don't need to apologise at all. I'm sorry, I didn't mean to.
You're a healthcare professional. You understand what it's like. You know, it's my job at the hospital at the moment has turned. I haven't been very clinical, but it's very managerial, and not that I really like that, but it's been quite stressful, and been working till late hours of the evening and getting up and getting to work early doors. It's just not nice. It's not sustainable, and it's not going to be like that forever. But we're under pressure at the moment as a trust, so it's been quite difficult. So please, someone apologise, and forgive us for our rudeness for not being in response to that. But yes.
Oh no, don't worry. Yeah, and I completely relate to that as well. I always get told off for saying yes to stuff, because then everyone around me is like, "What are you doing? You have no time as it is." Then you wonder why you get a flare up.
Exactly, but that's why we also do what we do, because we love what we do. And again, this sounds cheesy, but we do actually genuinely want to help people. We're not getting paid millions and millions of pounds.
Yeah.
So, you know, we get all that moral richness. So yeah.
That's it. Absolutely, I can relate to that.
Yeah. Right. Sorry. Oh yes. Thank you so much again.
No, thank you. That's been fantastic. And yeah, I'm scheduling from kind of end of March onwards next year already. So if you want to do something maybe in the springtime or something, that'd be great if we could get you back.
Put me down. Okay. No sort of times in the evening on a Wednesday are absolutely fine.
Okay, brilliant. I'll ping you an email with that as well.
Lovely. Perfect. Thank you very much.
Have a good rest of your evening. Thanks again.
Yes, you do too. And I'll see you soon. Take care.
Take care. Bye.
Bye-bye.